Differential diagnosis of multiple sclerosis. There are multiple tests that can be used in order to diagnose and differential diagnose multiple sclerosis. They are broken up into primary tests, secondary tests, and other tests for differential diagnosis. According to the Archives of Neuropsychiatry, primary tests include blood tests such as hemogram, renal and liver function tests, electrolyte levels, sedimentation, CRP, B12, folate and vitamin D, thyroid function tests, lipid panel, viral serology, which include anti-HIV, anti-HCV, HBsAg, and anti-HBs, VDRL, RPR, ANA, if an ANA positive, ENA profile, and anti-phospholipid antibodies, and anti-dsDNA. Another primary test is the MRI, which can include cranial, cervical, and thoracic, or cerebrospinal fluid analysis, which includes CSF protein, CSF and concurrent blood glucose, CSF albumin and IgG, CSF lactate, serum albumin and IgG, CSF IgG index, CSF OCB analysis with IF electrophoresis. For inpatients with optic neuritis, the VEP and optic coherence tomography tests are used, VEP standing for visual evoked potential. Some secondary tests used for differential diagnosis are the VEP or the SEP, which is somatosensory evoked potential. Also, optic coherence tomography, urodynamic testing, and cognitive testing. There are further other tests for differential diagnosis of MS, further biochemical tests. If vasculitis is suspected, a wider autoantibody panel, 24-hour urine analysis, GFR evaluation for rheumatological disorders, anti-CCP, serum complement levels for lymphoma, serum anti-beta 2 microglobulins for sarcoidosis, blood and CSF ACE levels. To rule out adrenoleukodystrophy, adrenal hormone levels, very long chain fatty acids for mitochondrial diseases, serum pyruvate, lactate levels for neuromyelitis, Optica anti-aquaporin 4 and anti-MOG tests. Other tests for differential diagnosis of MS are some specific tests for infectious etiologies, such as antibodies for Lyme disease and brucellosis, PPD, and quantiferin tests for tuberculosis. Angiography, which looks at cerebral fluorescence and MRA. Biopsies can be performed from the skin, lymph node, brain, and or leptomeninx, peripheral nerve. An eye examination to view the retina, evaluation for metabolic disorders, UV evaluation for sarcoidosis and Beck's disease, a hearing test for Susak syndrome, electrophysiology, nerve conduction studies, EMG. Chest x-rays can also be performed for chronic latent sequel infectious lung disorders and hilar adenopathy. Cardiac examination, such as the ECG for SLE and mitochondriopathies. And there's some other tests too, such as if you want to rule out Sjögren's disease, Schirmer test, and salivary gland scintigraphy for malignancies and metabolic disorders, SPECT and PET.